Hi, this is Keith Yeates from the University of Calgary. I'm presenting the first series of webinar presentations focused on what we're doing to research concussion in kids. The title of my presentation is Predicting Outcomes of Pediatric Mild Traumatic Brain Injury. It's relevant to the Concussion Symposium focus question in that it's important to be able to know which children are at risk for poor outcomes and which aren't, so that we can provide accurate prognostic information to families and also target our resources on the kids who are most at risk. Just by way of background, I'm a professor of psychology, as I said, at the University of Calgary. I'm the program lead for the University of Calgary's Integrated Concussion Research Program and also the lead for the traumatic brain injury team at the Hotchkiss Brain Institute. Been doing research on the outcomes of traumatic brain injury for about 20 years, including a focus on mild TBI and concussion, and involved in a variety of knowledge translation activities relevant to the symposium in terms of mild TBI and concussion. So in terms of what I'm currently doing, I thought I'd take one step back and talk just briefly about what I've done. First started doing research in this area nearly 20 years ago. With one of the first large prospective cohort studies with longitudinal follow-up, key findings showing that mild TBI is associated with an elevated risk of persistent post-concussive symptoms in a subgroup of children, but there are many risk modifiers or effect modifiers that are relevant in this population. I'm currently following up that study with a new study funded by NIH, again involving a prospective cohort. And what we're focused on is trying to understand how we can use common diagnostic methods to predict outcomes following concussion or mild TBI. We're assessing children in terms of their acute signs and symptoms in the emergency department. We're conducting acute assessments of mental status and balance in the emergency department. And we're obtaining neuropsychological testing and MRI at 1 to 2 weeks post-injury, with the imaging sequence including some more state-of-the-art sequences such as susceptibility-weighted imaging, diffuse intensor imaging, and resting state fMRI. We're following the children up for 6 months with assessments at 3 and 6 months, as well as weekly assessments of symptom status using a smartphone app. We're also examining pain, motivation, and symptom exaggeration as potential alternative explanations. The focus of this study is to look to see how each of the common diagnostic methods in isolation and then when combined is able to predict the trajectory of post-concussive symptoms and functional impairment in children with mild TBI. Having moved to Calgary last April, I want to continue this line of research, and my plan for the future is to expand on our existing cohort studies to do a larger cohort study that would incorporate variables that we've not looked at in detail, including genetic markers and markers of inflammation, to try to better understand diagnosis and prognosis. Also hope to begin to develop treatment programs that are multifactorial in nature and that we can begin to personalize the management of concussion and mild TBI in children with these problems. This is part of a foundation scheme proposal that I'm currently waiting to hear about. So in terms of what I think is working in this area, certainly I think that it's absolutely essential to have interdisciplinary collaboration. These are questions that can't be answered by any one discipline. We need to take a multidimensional approach to the problem. I think that in order to get the sorts of sample sizes that we need to provide really rigorous answers to these questions, it's also essential to involve multi-site collaboration, and I think that has worked very well, both in my own research as well as those of others. In Canada, the CIHR has provided some direct support for research on mild TBI. in the past at a targeted level, and I think that's been quite helpful. It probably is helpful that concussion, at least at the current time, is a hot topic in the media and consequently receives a great deal of attention in the community, and probably as a result of that, it's also not too difficult to obtain philanthropic support for research in this area. There are a number of barriers, I think, to progress in the area of doing research on concussion. One is that in general, I'd say that my own impression is that the major health research institutes in Canada and the United States continue to probably overemphasize a medical model and in their funding cycles. They also tend to encourage research silos by continuing to rely on the principal investigator model. In the days of team science, the incentives are not necessarily correct to encourage people to collaborate. There are always structural obstacles to doing research in clinical settings and with clinical populations that can make it difficult. Because the topic here is one that has become of increasing interest, we run the risk of overburdening families and children with research demands and stepping on each other's toes as we try to do research, often in silos rather than collaboratively. And it's clear that with the growing hot nature of the topic of concussion, that everyone seems to want a piece of the pie, both in terms of research dollars and study participants. And I think it really behooves us to try to do a better job of figuring out how to pool our resources. So what I'm hoping to get out of the symposium is that it will encourage interdisciplinary and multi-site team science, that we can figure out effective ways to pool our expertise and resources to do some really large-scale collaborative work. I think it'll be important to try to establish shared agendas for research so that we are targeted to answering the big questions that remain. And I'd like to see our ability to facilitate knowledge in action, or the translation of knowledge to action, so that we can actually affect clinical care and the outcomes of kids. Thanks for your attention. I'll look forward to your questions.